Good morning, everyone, and welcome to the People's House. I stand today joined with Dr. Bernard Ho, who is Executive Vice Chair of Canadian Doctors for Medicare and an emergency room physician in Toronto. Also with me is Ashley Fry O'Rourke, a registered nurse and an educator who is also the political action nurse for the Registered Nurses Association of Ontario. I stand before you today to urge Ontario to take meaningful action in expanding access to prescription medications by ensuring that all Ontarians, regardless of age or income status, have access to the medications they need covered under the Ontario Drug Benefit. Because access to life-saving prescription medication should not depend on your age, your income, or your employment status. And overwhelmingly, Canadians agree. In fact, 86% of Canadians have affirmed that access to prescription medication should be expanded. Canada is the only high-income country with universal healthcare that does not have a requisite fully funded Pharmacare program. We pay for the doctor's visits, for the emergency room visits, for hospital stays, for MRIs, blood work, and other tests, but not for the medication that your healthcare provider has prescribed to you in order for you to stay well. It's a gap that not only doesn't make sense, but negatively impacts the health and well-being of people across Ontario every single day. Right now, people in Ontario are choosing between buying groceries or buying their medication. Workers are having to decide between continuing to go to work in unsafe conditions or non-ideal working conditions or risk losing their benefits and their families' access to prescription medication. We can do so much better for the people of Ontario. Implementing universal public drug coverage that is both comprehensive and evidence-based would be the best way to ensure the accessibility and affordability of medication in Ontario. The expansion of Pharmacare would lower costs for all Ontarians, as medications could be negotiated through bulk purchases, and medication coverage would actually reduce the health system costs that we share. Because when we miss opportunities to treat illness early with the right prescription medications, we end up seeing higher rates of hospitalization, surgeries, and other complications that could have been avoided. We also know that when people are healthy, they are better able to participate in our workforce, our economy, and our communities. And at a time of economic uncertainty, expanding access to the Ontario Drug Benefit is one way our government could immediately act to support Ontarians and increase the resilience of our economy and our province. Right now, Ontario ranks among the top 3 provinces with the highest prescription medication deductibles in Canada. Through the Trillium Drug Benefit, Ontarians must spend 4% of their household income on prescription medications before they might be eligible for coverage. And at a time when rents are skyrocketing, food prices have gone up tremendously, and the cost of living is less and less affordable, this threshold for medication coverage is far too high for most Ontarians. This financial burden forces many families, especially those living with chronic conditions, to navigate complex systems, fight for approvals, and in some cases, forgo essential treatments altogether. Currently, Ontario's drug benefit is available to people under the age of 25, over the age of 65, or for those on social assistance or living in long-term care. And for those who have access, it's a fantastic resource that ensures that they don't have to choose between accessing their essential medication or putting food on the table. But there are far too many people across Ontario who are being left behind in that gap. For anyone between 25 and 65 who is working but might be self-employed or doesn't have access to private benefits, they are forced to make impossible choices. We know that for many, this choice ends up being to ration or skip doses of their medication because their budget won't allow them to take it every day. And for others, they may never be able to fill their prescription at the pharmacy and access the medicines that they need. And if we choose not to pay for medications Ontarians need at the pharmacy, we'll pay for it in our emergency departments and in our hospitals. And right now, we can't afford to allow our health system to be further strained, and we can't afford to let Ontarians become ill and suffer health complications when we could easily prevent it by providing access to the medications that they need. So how do we fix this? It starts with expanding coverage for prescription medications to all Ontarians, ensuring everyone has access to the treatments that they need. We can achieve this by immediately expanding the eligibility for the Ontario Drug Benefit to all Ontarians, regardless of age or income status. In doing so, we could show up for Ontarians at a time when they desperately need us to have their back. And I will now like to welcome my colleague, Dr. Bernard Ho, with Canadian Doctors for Medicare.
Good morning. My name is Dr. Bernard Ho, and I'm an emergency and family physician based in Toronto. I'm also currently the Vice Chair of Canadian Doctors for Medicare, a national organization of physicians and medical students that works to improve and strengthen Canada's publicly funded healthcare system. I am here today to speak about an issue that affects every family, every community, and every corner of this province: access to prescription medications. We pride ourselves on having a national, universal healthcare system, but the truth is far from that when essential prescription medications are out of the reach for many. In our province, the Ontario Drug Benefit helps seniors, those on social assistance, and some individuals under the age of 25. But there are so many others who fall through the cracks. I think of the single parent who comes into my emergency department with complications of diabetes because she skips filling her prescriptions to pay for rent or groceries. Or the recent graduate with asthma who can't afford their inhaler anymore because they've aged out of the youth plan. Or the many patients in my clinic with no insurance who suddenly face a new costly monthly bill because of a new chronic condition. Almost a quarter of Canadians report not taking their medications as prescribed due to cost. This is unacceptable. We know that when people don't take their medications, their health outcomes worsen. Preventable conditions escalate. Emergency room visits and hospitalizations increase. Universal Pharmacare helps us stop these issues before they even start. When people can afford their medications, they are more likely to manage chronic illnesses and recover from illness quicker and avoid serious complications. That means fewer people getting sick, missing work, and needing costly hospital treatment. It's not just about compassion, it's also about common sense. A recent study from the Canadian Parliamentary Budget Officer found that a national universal pharmacare system could save Canadians over $4 billion annually. The reason is simple: bulk buying power, streamlined administration, and reduced overhead. Ontario has the chance to lead by example and demonstrate these savings. Universal pharmacare also eases the burden on employers and employees. Today, many employers struggle to provide comprehensive drug coverage. Rising premiums eat into wages and profit margins. And for small businesses especially, this is a major hurdle. A universal system lifts that weight and lets businesses focus on growth rather than grappling with insurance policies. And families, too, will feel the relief. They will no longer worry about whether they can afford their child's antibiotics or their partner's blood pressure medications. At a time when housing prices, groceries, and other necessities are at an all-time high, life-saving medication should not be on that list. The infrastructure is already in place. Ontario has a public drug program. What we need now is the leadership and the political will to close that gap and cover all Ontarians, not just based on their age or income. Extending coverage to everyone means no more paperwork proving income eligibility. It means lowered administrative costs and fewer delays. It's simple, it's fair, it's efficient. Premier Ford, Minister Jones, and members of the Ontario government, the time to act is now. You have an opportunity to show the country what real leadership in healthcare looks like. Not only will this decision improve lives, it will save money, strengthen our healthcare system, and ensure a healthier future for every Ontarian. Thank you.
Hello, everyone. My name is Ashley Fryer-Rourke, and I am a policy and political action nurse with the Registered Nurses Association of Ontario. I'm here this morning to share with all of you the importance of a universal pharmacare. So, in order to do this, I will give an example of a client that I have worked with in the past who had spent weeks in the hospital on their cancer treatment regimen, and upon discharge had found out that they were not covered for their medications. They needed to self-fundraise in order to pay for their medications while living in the community, only to not be able to fully afford the extent of their medications and come back to hospital. This is only one example of many clients who leave hospital on a specific medication regimen and then need to come back to hospital within days to weeks because they cannot continue their treatment at home in the community. We urge you, the provincial government, to consider universal pharmacare for all Ontarians to ensure healthy and accessible care to all. Thank you.
Thank you very much to Dr. Ho and to Ashley for joining me today. And I hope that the Conservative government kind of will listen to these two experts in their field in advocating for the expansion of the Ontario drug benefit eligibility. Thank you very much.
Okay. Lovely. Dr. Lennox, I'm just wondering, it seems like one of these things that sounds like a no-brainer, but from your past experience and present one as well, what do you see as the hurdles to why what you're proposing today isn't something already in place?
Thank you. And like you said, expanding access to prescription medication is a no-brainer. It's cost effective, it's better for people, it's better for our collective health system. The only thing we're missing at this point is the political will to actually implement. We've implemented it at different times for different age groups like we talked about, and it's really now just about addressing the final gap of those between 25 and 65. And we can do it. We just need those who are in power to be able to use that power to actually make this change.
In terms of that will, have you spoken to any of your colleagues in other parties about their appetite for this?
Yeah, it's very interesting. I actually just had some conversations this weekend with other MPPs from different parties, including the Conservative Party, who did show an interest in this and understand the importance of access to prescription medication. And so I'm looking forward to, as we discuss this more today and as we debate my motion tomorrow evening, hearing from the Conservative caucus about how they would like to approach this and their willingness to actually address this gap for Ontarians.
That's all I got.
Thank you so much. Great.